Hello, everyone. Happy Thursday. Yes, this is season 2, episode 1, which focuses on an important month which celebrates American Heart Month. But we decided to honor this month by focusing about women heart health by bringing on specialists that specialize in that department, as well as individuals that have experienced any heart health issues. But for this episode, we have Kiran, who is a registered heart health dietitian, with us to educate us all about the importance of heart health. So, Kiran, please introduce yourself and tell our audience a little bit about you.
Okay. Well, hi, everybody. I am Kiran Campbell. I am a registered dietitian. I've been practicing for about 15 years. I didn't start out with, specializing in the area of cardiology or cardiovascular nutrition, but just over actually the past less than 5 years, it's kind of been a passion of mine to kind of more focus more on that, mainly because as I get older, heart disease runs in my family. My dad had high blood pressure. My dad had high cholesterol. My daughter, she's only 11 and she actually has issues with cholesterol. So it's really, really, deeply rooted in my genetics. And it's something I just feel very passionate about. And I work at a hospital and I cover the cardiology floor at the hospital. I give a lot of heart healthy diet education after people have stents placed and open heart surgeries. And I teach at the hospital a cardiac rehab twice a month. So just to like local community members. And so that's how I kind of got started with my website, the kcampbellnutrition.com, which focuses all on cardiac health, nutrition, lifestyle changes, behavior changes, things like that, recipes. So I've been doing that for the last 3 years, and it's been honestly a dream. I love what I do, and I don't plan on stopping.
Thank you for sharing with that with us. And I'm sorry that you are experiencing going through that, but you're using that experience to empower yourself and help the individuals in your life to know how to manage those heart health issues. Why do you think that it's important to highlight heart health, particularly for women?
Well, it's focusing on heart health in women particularly is important because historically it's been under-recognized as a women's health issue, despite it being the leading cause of death for women in the United States. And also traditionally, most of the research is done, it's usually focused on men, which then leads to tests and treatments being primarily developed for male patients. And a lot of times medical professionals and sometimes women themselves will dismiss the heart symptoms that they're having. And women are basically unaware of their risk level because of this. So it's really, really important, not just for on American Heart Month, but all year round to just kind of be, more aware, raise the awareness for the women's risk for heart disease and stroke and things like that. Because again, we'll talk about this later, but the symptoms are different for women than they are for men for stroke, for example. So it's super important.
Yes. And I know that you're going to dig more into that later because it's one of our questions. But I do love that you made an emphasis on that. The reason why heart health in women is important is because we mainly think that it's a man disease, right? But there are women that develop heart disease. There are children that develop heart diseases. It's all can be linked to genetics. It can be linked to lifestyle. And it's important that you were able to highlight that from your experience as an expert in that field. Because through my experience with talking with individuals that have went through heart attacks or that have had other heart health issues, one of the things that they say is that they didn't know women can get heart attacks. They didn't know women can have cholesterol issues because it's not something that's constantly talked about or there's no awareness around that issue. And that is why we wanted to cover this topic for this month, because we did our research and found out that is the issue as well. So thank you so much for bringing light to that. So can you explain the linkage between diet and heart health? How much of an impact does nutrition really have when it comes to heart health?
Well, proper nutrition is critical to heart health. It's not the only factor, but it is a very, very important one. That everything it revolves around diet and also lifestyle. But diet is the one thing that could determine, whether or not you do develop heart disease later on in life, or end up having an open heart surgery or a triple bypass, later in life. So what following a heart healthy diet does is it can prevent you from things like gaining too much weight, or stopping your lipid levels from rising, or it can help you reduce your blood pressure. The first thing people, when they have high blood pressure, the first thing we tell them to do is look at the sodium in your diet. You need to, reduce that sodium. It can reduce your risk of diabetes. So basically why diet is so important is it helps you reduce a lot of those risk factors for heart disease. So that's why it's so important.
What are the major risk factors for heart disease in women, and what would be some of the signs or symptoms to look out for?
Well, women have actually very unique risk factors. They're very distinct heart risks that men don't. And so, for example, women even get pregnant, and there could be pregnancy complications like preeclampsia, which increases your heart disease risk later in life. There's menopausal related hormonal related heart risks that can change and affect your heart health. There are several autoimmune conditions like rheumatoid arthritis, lupus, MS, which can increase inflammation in your blood vessels, and can actually cause hardening of your arteries. So those are all things that women can, develop that basically can increase their risk for heart disease.
Got it. So underlying health issues that they may not be aware of can cause heart attacks to happen, which I've researched and figured that out as well. And being pregnant now, I've never had preeclampsia, so it's scary to even think about that.
Right.
It goes back to diet, right? How your diet is during whether you're pregnant or your lifespan.
Mm-hmm.
So, as you said, those underlying health issues, we think that it's just something that you treat or goes away, but we don't understand that it leads to other health issues like heart attack or cholesterol and so on. So, thank you so
Mm-hmm.
much for sharing that with us. Are there any particular foods or diet habits that are harmful to heart health that women should stay away from?
Yeah, a lot of these are actually, very similar to what we would prescribe for a man. They're kind of go, for everyone. Everyone who has heart issues should be very leery of eating basically the standard American diet. Okay, so low in added sugars is what we recommend, low in saturated fats and trans fats. A typical American diet is high in sodium, like I said, so keep that sodium level to a minimum.
Okay.
The Heart Association actually recommends 2,300 milligrams of sodium a day for the general population. But if you have high blood pressure already, then lower it even more to 1,500. So there are specific guidelines, for the fat and the sodium, and cholesterol, not so much anymore. They used to want you to limit your cholesterol to a certain amount per day, but now they've kind of steered away from that, and they more so want you to look at the types of fat you're consuming. So consume more mono and polyunsaturated fats and stay away from the saturated and trans fats. Okay, so low fat, low sodium. If you're following a low fat diet, you're already probably following a low cholesterol diet, because a lot of the same foods that are high in saturated fat are also high in cholesterol.
Individuals, when they're going through the journey of trying to just live a healthy lifestyle, they find it really difficult at times to just stick to the diet. During those period of times, would be your advice or words of encouragement to find a way to just stay consistent?
Well, it's going to take consistency and determination. You got to want it,
Yes.
because life is all about balance. Like anything in life is about balance and moderation. And it's a huge struggle, even for me, so like when you go grocery shopping, we always say, make a list and try and stick to the list, and, don't get, what do you call it? The impulse buying, try and not impulse buy. Your kids might be with you and they want everything on the shelf, and the Oreo cookies and the potato chips. Yeah. Yeah. But I'm sure you can probably talk to a registered dietitian in your area, or or maybe there's some type of heart healthy class, and they have like really heart healthy like grocery shopping lists that maybe they can get you, stock up. And it doesn't have to be you don't have to stick to the perimeter of the grocery store. There's a lot of good things down the aisles too. Um, but you have to be aware of where they are. Know how to read a food label. That's really important. Stock up on your frozen fruits and vegetables, or even the no salt added canned foods. Those can be just as healthy as fresh fruits and vegetables. So, but it's really hard to balance, a busy lifestyle with heart healthy.
Yeah,
Yeah.
because you have to plan ahead, right? It's like you have
Yeah.
to plan ahead to make sure that you get the healthy food, you prep the food, and then you have to navigate all other parties of your life. So it's hard, but it's not impossible. It's not impossible.
Exactly.
So you mentioned learning how to read food labels correctly. Some of us still don't know how to read a food label correctly, right?
Mhm.
Or even how to know if a fruit is actually organic or if it's lab made. How would you recommend that people go about that?
Well, you don't. There's such a thing as like the dirty, or the dirty dozen, and there are certain fruits and vegetables that they have on that list that if you don't buy organic, they have a lot of pesticides and chemicals on them naturally. Like I think grapes is up there as one of the top ones. Peaches is another one. I know organic can be expensive, so in a lot of areas you might not be able to afford, buying organic all the time, and that's fine. You can, just go home, make sure you wash your fruits and vegetables before you use them. So it's not a necessity to buy organic, but I still make use of organic when I can, especially certain fruits and vegetables. Also, you can make use of your farmers markets if you want to, like in the summertime and stock up then. But like I said, you can even do like the frozen fruits and vegetables. They come in real handy. And one thing I love about buying frozen is it lasts. A lot of times you buy fresh fruit and it spoils so quick, especially like berries.
Nowadays, yeah. I find that you have to buy every week. Fruit goes bad in
Yeah.
2, 3 days.
Yep.
Yeah, which is costly.
Yeah. Yes. And
But
there's a lot you can do with the
yeah.
frozen, you can cook it, or you can put it in smoothies, which is super convenient. So a lot you can do with frozen.
Thank
Hmm.
you for just educating us on just being more active on knowing how to read our labels and knowing what type of foods to purchase. But like as you said, when you get your fruits, the most important part is washing your fruits, right? And isn't that with
Right.
soap and water? There's a certain fruit washing product for that.
Right. Yeah. Yeah. Even if you want to mix a little bit of, what do they say, a little bit of vinegar with the water.
Yeah.
I think they tell you to do that. Yeah.
Yeah. It
Also
brings
with
all
the
the dirt out.
Yeah. Also with the food labels, when I'm teaching the cardiac rehab class, you always want to look at first the serving size. Everything has a food label. If it has a food label, because fruits and vegetables obviously will not, but if it does, you want to look at the serving size, because all of the numbers under that serving size are based on what a correct serving size is, a portion size.
Yes.
So 4 things I tell people to look for on a food label are the amount of fat. You want to keep the amount of fat less than 3 grams per serving of total fat. Next is the sodium. You want it to be 300 milligrams per serving or less. Then there's the fiber. You want fiber to be 3 grams or more per serving. And then the added sugars. Added sugar should be less than 3 grams, or less than 3 grams per serving. Now, not all foods are going to meet all 4 of that criteria, of course. Only foods that will meet all 4 of the criteria are fruits, vegetables, and a lot of your whole unprocessed grains,
Yeah.
because those are naturally going to be very low in sodium, high in fiber, no added sugars, etc. But I don't expect you to eat or just live off of only fruits, vegetables, and whole grains. It's more about looking at your diet as a whole, your dietary pattern, we call it. Does that make sense?
It does. There's a lot, but it makes a lot of sense because it's,
Yeah.
like you said, it's knowing your food intake, knowing your food group so
Mhm.
that you're able to manage your heart issues. But since we're on the topic of the heart health class that you teach, can you talk a little bit about that and what individuals that attend your class can get from your course?
Right. Now, this course is only for, people or patients of the hospital, but I do plan on hopefully making this course available for people that visit my website in the future, hopefully this year. But we talk about a lot of different things. It's basically a whole bunch of different topics that I cram into 1 hour of me speaking. And I go over, your cholesterol, your lipid levels, what the numbers should be, because there are specific numbers where, you have to keep your LDL cholesterol under 100, things like that. I explain what each of the lipid levels are, your total cholesterol, your HDL, your LDL, your triglycerides. I do talk about a lot about plant-based eating, not necessarily that you have to become vegan, but all of the top heart healthy diets out there are plant forward. They want you to eat more plant-based foods and kind of minimize the animal meats, because when you think about it, all animal meat you can think of contains saturated fat and cholesterol. Whereas any plant product you can think of in the whole world, plants do not have any cholesterol, none. If a product is completely plant-based, it should have zero cholesterol. Okay. And I talk about where cholesterol comes from, which, by the way, cholesterol only comes from two different sources. Our liver naturally makes it, and it comes from the foods that we eat, animal products. I talk about fiber, why fiber is so important for heart health. I talk about low-fat foods, whether or not they're good, bad for heart patients. I talk about added sugars, why those don't only impact those with diabetes, but it's also important to reduce the added sugars for heart patients as well.
Yes, I do agree with you on that. Is dairy products, but like animal products that actually aid to high cholesterol and heart issues. And sometimes, dairy products we think are good for us, right? Because back in the days when they spoke about a nutritional diet, milk, yogurt, meat, all those things were mentioned to have a well-balanced meal. And we're learning as we go, like actually those fruit groups go against the health of our body. So thank you for sharing that. It's actually not good for us. More fiber, more a plant-based diet is what helps us, in a sense, somewhat reverse cholesterol and reverse heart health issues and sustain a healthier life.
Yes.
How are heart attacks in women, and we spoke about this earlier, different from heart attacks in men? And why is this important for women to know?
Okay, so some of the signs of a heart attack in women are a lot different than in men. So for men will typically get the classic chest pain symptom. Okay, but women might have symptoms like shortness of breath, nausea. They could get vomiting. They could feel dizzy. They could be just really fatigued, or jaw pain. Jaw pain is a pretty common one. Back pain. So all these symptoms I just mentioned, you may guess that they might not always present as you're having a heart attack. Red flags, aren't going off like chest pain, like you would get chest pain. Of course, if you get chest pain, you're thinking, oh my gosh, I'm having a heart attack. But if you're like super, super tired one day or short of breath, you might just think, oh, I just didn't get enough sleep last night, or I just need to take a nap. But really, you need to go to the emergency room because you're having a TIA or you're about to have a heart attack. Women might not, they don't know these risk factors. They don't know these symptoms. So they don't get help when they need it. And that's part of the problem. That's why heart disease is so super important to educate women on, because that's the issue with why the mortality rate, I guess, is so high in a lot of women, because they don't recognize the symptoms when they're happening. And then that prolonged care, the care gets delayed is what happens.
And I'm happy you spoke on that, because from my conversation with an individual that had a heart attack, that's going to be coming up as a guest on season 2, episode 2, she talks about how she experienced chest pain, and she didn't really notice that as a sign that she's having an active heart attack or the beginning of one. And it's important that you mentioned that, because as you said, we can confuse it with indigestion, right? heartburn. Maybe we confuse it with, or it could be, like you said, I'm just tired and maybe I just need to relax, right? But that's actually one indication, whether this commonly happens to us or not, to just go get checked out. So I'm happy that you're bringing light to that, one of those symptoms for women to be aware of when they're actively
Right.
having
And
a
that's,
heart
yeah,
attack.
and that's another thing with care getting delayed. Women are a lot less likely to get help when they need CPR too. You're aware of that? Because people
Yeah.
are always afraid to give a woman CPR. They're afraid of, you know, exposing them
Oh,
inappropriately, or it's not even inappropriate. They need help, but they're afraid of being accused of touching them inappropriately. And so a lot of times women don't get CPR when they need it.
do you foresee
I'm
that
hoping
changing?
so. I think people, they need to take, classes, CPR classes, and they'll tell you that there. They'll tell you exactly how to use an AED. AEDs are everywhere. Those machines that can save someone's life when they're having a heart attack, they're in malls and they're in schools and they're at the movie theater. So if just look around for an AED, you can find one, but you need to know how to use that
Yeah.
in an emergency.
Yeah, that means taking courses to really know how to operate
Yep.
the machine. And that's why I think, outside of that, that's why I think it's very important that we all know how to do some form of
Yes.
CPR as well, right? To help somebody as well. But that's another
Right. Yeah.
topic that I don't want to dig deep into today. I want to focus on this topic. So for women with busy lifestyles, and we covered this earlier, they're balancing life, work, self-care sometimes if they even have time. What are some practical tips for maintaining a heart healthy lifestyle?
Well, I mentioned earlier, like the whole balance thing. It's really hard for even me to do as a registered dietitian. I mean, I have family. I work full time. It's a lot of responsibility, and if you don't plan, it's still possible to. Is you have to have that grocery shopping list. So focus on getting your whole grains in there, getting those fruits and vegetables. If you can plan your meals for the week, great. Stock up on those frozen fruits and veggies. Pantry staples. Make sure your pantry is stocked full of heart healthy foods. So even if you don't plan something, you'll always have something in the pantry to make. So some good pantry staples might be like canned beans, canned tuna, packed in water, not the oil, any whole grains, oatmeal, barley, rice. If you want a good snack, unsalted nuts are a good snack. 'Cause all nuts are healthy. You can batch cook on weekends and freeze things. I'm big into like cooking in large quantities and freezing it. I love that. Prep your fruits and
Definitely.
veggies as soon as you get home. Keep a fruit bowl. I love just keeping a fruit bowl around the house, because a lot of times my kids just kind of, when they're hungry, my 5-year-old, he goes through so many apples and bananas just because they're within eyesight, you know?
So that's important, having
Hmm.
it be accessible to you, right? Vegetables and so on. It does
Hmm.
go away quicker than it would if it was just regular food, right? But of course, some will argue that it'll go quicker. It doesn't go quicker than
Right,
junk food,
right.
but
That's what we try to get
with
people to kind of plan the meal, not so much around meat being the star of the show, but kind of maybe do a meatless Monday one day. Get those more plant-based foods into your diet somehow. You can, use them, eat them as snacks, with veggies and hummus or something.
I'm happy you covered that. So for those that want to do no meat, no meat during the week, no meat diet, what would those food groups look like? Because you have to
Yeah.
cover protein,
Yep.
grain,
There's
and
a
all of
lot of
that.
good plant-based sources of protein. Like you can, like beans, of course, is one. I mean, there's only so much, chili you can eat, but there's other things you can do with it too. Lentils is huge, because all the beans and the lentils and things like that, those plant-based sources of protein can actually help you lower your cholesterol. So that's why we like to put, because of the fiber. The fiber content is what does it. The soluble fiber in them. But even oatmeal
Yeah.
will have protein in it. I think, well, half a cup of
Yeah.
oatmeal has like 6 grams or something like that. There's edamame, those young soybeans you can probably get in the frozen food section. That's where they are at my grocery store. What else? Nut butters are good to use. You can use nuts or any type of nut butter. What else? Tofu. You can always do soy products. Soy products are
I can
Really?
never get with tofu. I don't know. I tried it before. It's just it tastes like meat, but
Yeah.
fake meat. I'm like,
On
I
on
just
my
can't.
website, I have
I
a
just
really
can't do
good
it.
recipe for like an eggless egg salad, and it actually uses tofu instead of eggs. So you can sneak it in there.
Okay. I might try that. I might try that. Definitely. I'm open to, anything that is good for the health, right? So, because the order you get, it's not about taste, really. I mean, as long as it doesn't
If you
taste
use
bad,
herbs and
yes.
spices, you can doctor it up.
Yep. Like you said, herbs and spices makes everything taste good. But in moderation because some of them have salts. So it's knowing which herbs you buy doesn't have salts, but that means using the natural herb at that. How important are physical activities? I know we didn't cover this earlier, and stress management in managing heart health.
Well, physical activity and stress management and maintaining heart health are incredibly important. Like physical activity recommendations, the Heart Association recommends 150 minutes of moderate physical activity every week. So 150 might sound like a lot, but you can fit it in. If you do 30 minutes 5 days a week, that's your 150. You did it. But you need that cardiovascular activity, and even weight training twice a week is recommended too, to strengthen that heart muscle. Your heart is a muscle just like all the other muscles in your body, and you need to work it out to get that blood pumping more efficiently, more effectively, maintain healthy blood pressure, improve your circulation. So that's why the physical activity is so important. Also, there's a ton of metabolic benefits to physical activity. And as far as stress, managing your stress levels, which is another thing I talk about in my cardiac rehab, is stress. But reducing that stress is so important because high amounts of stress, what does that cause within your body? Cortisol levels are increasing. Cortisol is that stress hormone. So anytime that stress hormone is constantly elevated, it can lead to inflammation. And inflammation can lead to the development of chronic diseases like heart disease and any other chronic disease out there. So managing stress is not only good for reducing heart disease risk, but all other chronic diseases, period.
Yes, yes, yes. I completely agree. Like you said, if the diet aspect is incorporated into your lifestyle, but stress management is not controlled, then, as you said, it's just going to aid to the health issue or any other. It can be heart issues or it can be other health issues. Like you said, two of the components come together to aid for a healthier lifestyle. So are there any particular challenges or considerations for women in different age groups when it comes to heart health?
Yeah, actually, in a lot of women in their 20s and 30s, they actually often underestimate their risk for heart disease just because you're young, you're still a lot of times healthy at that age. So they kind of blow it off. They're not really thinking so much about health. They're more thinking about creating a family and getting married. And they're not really thinking about their heart health risk at that age. But also this age group, they might be on birth control, which could increase their risk, especially if you combine that with smoking. That actually elevates the risk of heart disease. They might have high stress from, the stress of building a career. Or building a family. And then you get to your 40s and 50s, and then perimenopause happens, menopause happens, hormones start changing, blood pressure can naturally rise the older you get. Your cholesterol and your LDL level can increase with age also. Your weight can, because hormones are changing, that can lead to weight changes, and increased weight is a risk factor for heart disease as well. So yeah, there's constantly more challenges. And with each decade you get older, there's also a lot of life stresses that happen on, at each age period as well. If you end up with heart disease, you might want to look back and try and pinpoint, what was it? What did I do? Was it because I smoked? And was it because I didn't exercise? It's probably a combination of everything, and we don't expect you to be perfect in every area. That's just not realistic. But work on the risk factors that you have, so that if something does happen later on, at least you're more aware, I guess, of how it happened and where you can change moving forward.
So I spoke about this earlier about how just a few seconds ago, how culture can influence one's traditional role in living a healthy lifestyle. How can that be adapted into one's lifestyle when trying to prevent heart health issues?
You can still enjoy a lot of your cultural and traditional foods. The cultural influences and traditional diets, they're very complex, and they have very complex effects on women's heart health. And they're going to vary across different communities, of course. There's Asian and Latin American and Mediterranean diets and South Asian and African American. They all have different cuisines and different dishes within that culture. I guess how to make that more heart healthy could be a challenge for a lot of people, but recipe substituting ingredients can go a long way. So each of these cultures uses unique spices and spice blends. So, and they have certain traditional dishes, but you can adapt them to be more heart healthy by using maybe lower fat ingredients, different cooking methods. Sometimes if something is traditionally fried, maybe you can instead try air frying it or baking it. Or, for example, you could even use, this is a very, very simple one, but use leaner cuts of meat when you're preparing the dish. Use less sodium, or use more herbs like garlic powder and onion powder, oregano, basil, whatever the spice would be. I will say one of the only spices that comes to mind that does still add a lot of flavor, but it does have sodium, is chili powder. Chili powder still has a little bit of sodium, but if you're using the straight herb, like straight up oregano, basil, paprika, whatever, maybe tarragon, none of those will have sodium in it. Okay. Or any of the whole Mrs. Dash line, those are all completely salt free.
Yes, I've used that before. It's really good too. And sometimes we think the more salt we use, the better the food is. No, it's just salt. It's
And
just
your
salty.
body, your taste buds will actually get used to eating a lower sodium diet. I can't tell you how long it's different for everybody. You could get used to it after 2 weeks. It could be 2 months. But eventually your taste buds will adjust. And pretty soon you'll be, out at a restaurant with one of your friends and eating some soup that you ordered, and you'll think, oh my God, this is so salty, because you're not used to it anymore.
Yes, yeah. I hear my father saying that a lot when he eats some of my food. He's like, "Oh my God, are you trying to kill me?" And I'm like, "Just salt in there." So it made me just think a lot to cut back on salt, especially being pregnant now. So not doing that too much because I don't want to end up getting pregnancy diabetes. That's not going to be good. What are some common barriers you've observed that prevent women from putting their heart health first, and what would be the outcome of that?
Well, for women in particular, I feel like we carry a lot of the family burdens. We're doers. Like, we have a lot of life stresses and mental health issues and depression and things like that related to whatever's going on in our life. And it makes it harder to maintain healthy habits. So I think we really need to bring attention to, focusing on yourself, because a lot of women, I feel, think of it working on themselves and doing things for themselves as selfish, but it's not at all. It's self-care, So, and if you're not taking care of yourself, how are you going to take care of the rest of your family? They rely on you. They need you, and you need you. So self-care is not a selfish thing, and it shouldn't be something that you put off to meet everyone else's needs. So focus on self-care is one thing I would say. Another one is there's limited access to care. So people who do have limited access to care, make use of telehealth. A lot of places will make use of telehealth now, so you don't have to go in person. There's also knowledge gaps. So educate yourself through reliable sources. The American Heart Association is always a good source that I recommend. Health organizations like the CDC or the World Health Organization. So try and fill those knowledge gaps, listening to podcasts like this that can help educate you. Another one, don't dismiss your symptoms. Okay. Get those checked. Don't just blow it off. If you said indigestion, don't just blow it off and take an antacid thinking it's nothing. Okay. So yeah, life stressors, the limited access to care, the knowledge gaps, and dismissing symptoms. Those are some pretty big areas that we can do something about.
Yeah. So stay proactive, be aware, and take actionable measures if anything happens. So are there any apps or books on other resources you recommend for women looking to improve their heart
There
health?
are a ton of books out there. I like a lot of books by, there's kind of like these heart health doctor like experts, Dr. Caldwell Esselstyn. There's Dr. Joel Furman, Dr. Michael Grieger. They have written have multiple books, but they've also written books specifically on heart health for anyone who wants to get more educated on a heart healthy diet and lifestyle. There are a lot of good websites that focus on plant-based eating. I subscribe to a lot of them. One of them is the Food Revolution Network, Forks Over Knives, which is more whole food. They focus on more whole foods, plant-based recipes and things. The American Heart Association, of course, is the number one resource, which is just heart.org. And then for women, they have their own campaign called GoRedForWomen.org. And that has a lot of good women-specific information on heart health there. They do also have an app. It's a called Heart and Stroke Helper app. So you can probably find, I think it's available for iPhone and Android. And you can use it to like manage your cholesterol numbers, track your lifestyle habits, things like that. It's super, super helpful. And it's a trusted resource.
Thank you so much, Kiran, for taking the time to be here with us. The interview is coming to a close. So can you please let our audiences know how they can connect with you and learn more about you?
Yeah. The best place you can find me is on my website, kcampbellnutrition.com. I also am on Instagram, which my handle is kcampbellnutrition. I have a Facebook group. It's a private Facebook group. But if you search for Heart Healthy Diet and Lifestyle Support Group, you should be able to find it. You just have to answer a couple of questions and I'll let you in. But it's a really good place all those places are really good places to connect with me and just get more information on nutrition and lifestyle information for heart health.
Thank you so much, Kiran. We appreciate it. So everybody just please make sure to stay in contact with Kiran. She also have shared some files with us that just has many resources for you guys that we will put on our bio link, and also we'll provide it on the episode description for her posting on YouTube and the podcast platforms. So thank you so much. And as I always say, please share this episode and all of our episodes with family and friends. We look forward to bringing you with more educational episodes. And thank you so much. Thank you, Kiran.
Thank you, Faven. It was an honor.
Thank you so much.